The other thing, we had a request by a council member to do an update on the coronavirus and our preparations. So I would invite up at this point Stephanie Hackett, our emergency management coordinator. While she's coming up, I'll just mention a couple of preliminary comments. We are prepared for any emergency. So we are spending time now to be especially prepared for this as it's heading our way, obviously. But we're prepared. We live next to an airport. We prepare for that type of emergency. We have 2 train lines running through this town. We have blizzards. So Stephanie works full-time, shared by the fire department and the city of Brighton, and we appreciate all her efforts to continuously keep us ready for anything. We are taking this one seriously. We have developed a policy in previous years on a pandemic in 2009. And so we already had that in place, and we brought that back out. We did update that recently with input from all the directors and our outside partners and agencies. So that is ready to go. That really affects more the internal operations of City Hall, our buildings, our employees, and how we relate to the customer service of the outside world. We're very concerned about providing continuity of operations, regardless of the number of staff level that we can maintain. And we're very fortunate to have use of new technologies since 2009. We're very focused on how we can work smart and have systems still running and work remotely, even if our staff levels go down due to this coronavirus. And we believe it's our job to provide essential services regardless of what the state of affairs is. So we will be here one way or another covering the needs of the city. Stephanie will go into 2 documents, which I will also send down the way so you have. She's going to be summarizing the front and the back of this document. One is not the actual policy that I just described, but it's a summary of the internal. It's a blanket pandemic policy that covers any pandemic, which this is not yet, especially in our area. It's that we're prepared for that. The other is the points she will go over is just a general summary of where we're at in the situation. Stephanie, take it away.
Thank you. And then I really like to thank you for having me here tonight. And I really like that you mentioned that we're using the words outbreak and illness and pandemic interchangeably, and they're not interchangeable. So right now, as defined by the World Health Organization, and they're the guys that get to decide whether it's a pandemic or an outbreak or just a health condition that they're monitoring, based on information that they're monitoring and that they're analyzing, it's still considered an outbreak and not a pandemic. Now that may change at some point, and we do have the ability to look at our internal plans and apply them in ways that we think are most appropriate. But I feel like that's something the media is not making clear, and again, it's something that's being monitored. We're not at a pandemic right now. We actually have no cases as of this morning, so things could have changed. Things do change hour by hour, but as of this morning, we still had no cases in the state of Colorado. As of this morning, we had a total of 37 people tested within the state, and 29 of them have come back negative, so that's good news. And we've got 8 of those tests still pending. Kind of cool what's happened since yesterday. They just opened a new lab within the state of Colorado that allows us to do testing here as opposed to taking the samples here and sending them to the CDC and waiting a week for the test results to come back. They should now be able to get test results. Yeah, imagine that. So they should now be able to get test results within 24 hours. If they get a positive result, they're going to move forward with that person of interest and proceed as if they have the virus. And then that test result will be verified at the CDC. But we don't have to wait a week for the CDC to give us those results back. So that's a pretty cool development that's happened in the last 24 hours or so. Again, I've got some stats and numbers on there as kind of where we are with cases worldwide. Again, right now at Colorado, we're still at 0. We expect that to change any day now, though. So it's something we need to be monitoring, and it's something we need to be taking a look at. Obviously, it's a respiratory illness. It's spread person to person. It's spread through prolonged contact with folks within 6 feet. So you see folks wearing masks at the airport, walking around and thinking that they're protecting themselves from other people that are sick, and that's just not the case. So there's a lot of miscommunication, a lot of misinformation around masks. Masks are really effective if you are sick and it prevents you from spreading the sickness to somebody else. It's also very effective for our first responders and for our healthcare and our medical profession who are repeatedly spending time in close contact with people that are suspected to have the virus. So for the general public to be using masks, and for if you've got a family member who's sick, it's recommended that they wear a mask to not get the other family member sick. But in terms of general public, what they're really, and I'm sure you guys have seen this, but what they're really pushing is hand washing. Coughing into your elbow, the really basic stuff. Staying away from people that are sick, same thing that we should be doing during our regular flu season anyways. And by the way, we're in the middle of one of the worst flu seasons in decades. So we're all pretty used to dealing with the flu, and we shouldn't treat this any differently. So we've got a lot of our day-to-day stuff, our relationships with our public health department, our relationships with the state health department, our relationships on, I sit on the board of our healthcare coalition. We work really closely with Platte Valley Medical Center on a day-to-day basis on, training, exercise, and plan development. So the things that we do on a day-to-day basis, we have our updated emergency operations plan. All of these pieces are going to come into account as we're kind of working through this. And it's going to be a long-term event. So even if something terrible doesn't happen this spring and we don't get a large number of cases within the state of Colorado or in our area, we still have the potential for it to come back. So it's something we need to keep on our radar. And as we're working through our continuity of operations plans and working through our work from home plans here, it's not something that's going to be done and over with in a couple of months. So we need to keep that in mind when we're kind of trudging through some of our planning efforts. We need to keep that in mind when it comes to allocating resources. Just so you guys know, I make that caveat about the masks. Really effective for first responders, really effective for healthcare workers. We do have a cache of about 2,000 of them over at the police department. So if and when we know that we have first responders coming into contact with folks who do have the virus, we've got that as a PPE or personal protective equipment for them to be using. City leadership, along with emergency management, are going to be working on a weekly basis to talk about some of the things that go along with updating our pandemic plan. So that includes our continuity of operations plans, our internal plans around staffing, around essential services, essential staff, what those work from home plans can kind of look like. And how do we come up with a policy that is appropriate for folks who are working from home, and kind of what that looks like. So in terms of kind of what we're doing, again, we've got those weekly meetings. We've got a cache of some supplies. We're working with the department directors to start updating their COOP plans. So that's internal plans from staffing, essential services, essential resources. What are those essential tasks that no matter what we need to continue to provide to the public? What kind of cross-training might we be able to do within departments and among departments to help to maintain those essential services if we do have a large number of staff who are out because of illness? Making it really clear that even every day this applies, sick people should not come to work. Sick people should not be getting me sick. I don't want to be around them. They don't want to be around me. But we're going to be further emphasizing this policy kind of throughout the season, and making sure that it's not only for their own good, but for everybody else's good too. Part of our flu plan, again, employees will be encouraged not to come to work, and managers may be able to encourage folks to go home if they're clearly sick. Employees are required to use personal time, general leave, or bank time to comply. If we activate our pandemic plan, it'll allow us to give employees the option of going into negative time, so they can go into negative time up to 60 hours if necessary for a related illness. Employees who are traveling to a country with active travel restrictions, not good, but if they do that, then we're going to require them to go along with the CDC recommendations as to what travelers are supposed to do upon their return. We're going to make decisions about scaling back city services, closing facilities, canceling or delaying meetings or events based on guidance from CDC, CDPHE, and from Tri-County Health Department. We're going to be working with our partners in the school districts. We're going to be working with our partners at the counties and working with our partners in other cities. So we're going to have a lot of information that we're going to be analyzing before we start making decisions about, what might be the best for our employees and for the public around that. An option might also be to designate one location with limited access for the public to come in and interact with staff, so that emergency business can continue, but we do it on a limited basis. So we've looked at that as an option. And again, we're continuing to work with our IT department and our department heads to develop and facilitate that continuation of essential city businesses, whether that be through email, through phone conversations, through video conferencing, through folks working from home, and figuring out how we can be creative about protecting our staff and then also protecting the public as well. So that's kind of just a very high-level overview of our general pandemic. Again, it used to be called an H1N1 plan, but we kind of updated that to make sure that it's really going to be appropriate for us and kind of live with us through whatever happens over the next 5 or 10 years, and we'll be able to update that as needed, but it won't be a virus-specific plan. So, questions?
Questions for Stephanie. Councilmember Blackhurst.
For Stephanie, it gives me a great deal of confidence knowing that you are in charge of this. And
I'm not in charge of it, and I didn't bring it here. So in this instance, the public health is actually the lead in this.
Well,
so we're
I know,
integrating
but
into
you're
their
the spokesperson that
Thank you.
delivers that message to us.
Thank you.
A couple of things occur to me. One of them is that we can get some of this information that you've given us on the city website to start helping our citizens understand what is proper for them to do in preventative.
Did we do that like an hour ago or 2 hours ago? So we started with social media a couple hours ago, and we're going to start updating the city website.
Because many of the things you're talking about, something we can do all the time.
We should be.
Such as washing your hands. I saw a post today that was so basic that it's almost overlooked by people, like masks are not going to help you, washing your hands frequently, using hand sanitizer when you go to the supermarket and you're pushing those buggies that everybody else has been pushing. Some of the basic things to try to keep this under control. The other thing that concerns me, and I hope we're reaching out to our half a dozen or so senior living centers and places where those are the most vulnerable people. I see in Washington that some of the early deaths all took place in nursing homes where they're the most vulnerable to complications that could be deadly. And so I hope we're reaching out to provide this kind of information and help to our nursing homes and our senior living centers. Is that something you've?
So they participate in our Ancillary Healthcare Regional Coalition. So as a part of that group, they get the information directly from Tri-County as the facilitator of that group. But I think we can actually do more, and it's not too overwhelming within the city of Brighton to kind of do that personal reach out. So that's something that I can certainly initiate.
Identifying those high-risk populations and trying to go to them with some of this information, because I think from the information that we now get more and more of, that's where it's really critical. Someone that already has a lung issue.
Sure.
Some of the other people may not be affected as much, but they certainly could be deadly with them.
Absolutely.
So I appreciate all of your information, and thank you.
Thank you.
All right. Councilmember Cushing.
Thank you, Mayor. Thank you for providing this information. It's something that some people are really concerned about, and having that information out helps. The one question I've heard, and you keep reading there's no confirmed cases, but I imagine a lot of people get a cold. Maybe it's the coronavirus, but they're not going to rush off to the ER unless somebody has a really severe situation. I'm guessing the recommendation isn't for everyone who gets a cold, or maybe they even think, man, I have the flu, and they're not sure. Is there a recommendation of how you would get tested, or if you should get tested?
So right now they're testing people who have been to the areas of the world that have the highest infection rates and are showing symptoms. So if you've been to one of these 7 countries and you're showing symptoms, then you go in and you get a test.
And you go to the ER?
You can go to the ER.
Okay.
They do it at Platte Valley. They'll do it anywhere. So they'll take the test there and then they'll ship it to the lab. However, as this progresses and as it gets more common, and it's not just people who have traveled to those individual countries that are getting them, we'll see what happens. But at some point, they'll probably even stop testing for it. You have the flu, you have the virus, you're sick,
Right.
You stay home. It doesn't really matter what you have. When you have really severe symptoms, you go to the hospital. It doesn't matter what's causing your severe symptoms. You seek medical attention when you need it. So I'm not saying that's not happening now, and of course they're still testing. But as it progresses, and you get hundreds of thousands of people who have very mild forms of this who never seek medical attention, we're not going to know at some point what those numbers are going to look like, I suspect.
All right, thank you.
Any more questions? Well, it just comes down to, sounds like, basic hygiene.
Yes.
Stay home when you're sick. Wash your hands.
Yes.
I can't tell you how many times I'm in a public restroom, someone just walks out after, and it just,
So it's
I
your job to
just
call
can't
them out and
stand
bring
it.
them back to the bathroom.
We should have an alarm set at the exits, make sure your hands have been
We
washed.
do, and we do have some cool messaging. Oh, I don't know if it's cool. It depends on who you are. But we do have some cool messaging around hand washing and the coronavirus that we're going to start posting in public areas and in public restrooms. So just an extra push and reminder for folks to be doing some of those basic things. Again, and trying to educate our public and everyone relax, wash your hands.
Yep.
Stay cool. It's fine.
Stay cool.
Wash your hands.
Go.
But again, things are changing, and it's something that we're monitoring on an hour-by-hour basis. We just get inundated with great information, and so part of what I'm doing is taking all that information and trying to distill it into something that's not overwhelming and overly redundant for you guys and for directors as well. So we're able to make decisions based on the most current and accurate information.
Thank you for being there, your
course.
expertise. For all new council members, she's the expert at
Wash your
everything
hands.
emergency related.
Wash your hands.
Stephanie's been sent to out of state for helping out with many issues. So we appreciate you being in our community. Thank you.
Thanks, guys.
Marvin.